When people understand that colic is not really a serious problem, then they're less likely to want treatments for it. Well, colic is this nebulous condition where babies cry and they're fretful and they're very difficult to console. Nobody knows exactly what it is. You know, we think it may have something to do with gas or sudden kind of a spasmodic contraction of their stomach or intestines, but nobody's really sure exactly what colic is. There's all sorts of home remedies that people use for colic, but really the bottom line is 4 to 6 months of age, colic improves. We usually try to focus on reassuring the moms that if the baby's eating well, they're pooping, they're peeing, they're growing fine, their development is normal, that colic will just get better. You tend to endure it for the first few months of life, and then they just get better.
Colic is something that can happen around 1 month. You have this baby that's sweet and angelic, and all of a sudden they turn on you and they seem to cry for no reason. So we think of colic as not unhealthy, not hunger cry or not painful cry from being sick. Think of colic as letting off steam. Some babies have colic because their intestinal system is a little bit immature. Maybe they're having a little bit of lactose or milk protein intolerance, in which case we could change the formula. Some babies have colic because their neurological system is still immature and their only means of communicating is that high-pitched crying. We know in medicine that colic is not dangerous. It's not harmful to the baby. It certainly is harmful to the family and the mommies because we feel like, oh my gosh, what can I do to help my baby stop crying? And so there are a few things we talk about. White noise. We have all kinds of ways of mimicking earth sounds. The birds chirping or the water going through little brooks. And they even have these new things called womb bears. They make the sound of the inside of the womb uterine vessel sound. So they make that swish sound. So shoo, 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 shoo. Because the infants are used to that sound being inside of your womb. So those are helpful.